Hi, I'm John Russell, and I'm a nurse practitioner who assists in the management and care of cancer patients. Given that I deal with both Medicare and private insurance companies on a daily basis, I would like to address Paul Ryan's plans for Medicare, which my opponent in Florida's Congressional District 12, Gus Bilirakis, has voted for.
Washington has not been honest with you about Medicare.
And Paul Ryan has not been honest with you about why he plans on eliminating Medicare.
Medicare is a critical program which helps seniors achieve health security.
And Mr. Ryan's plan is to completely eradicate it, changing it into a private voucher system.
We can save Medicare, but we have to reform it.
To Mr. Ryan, the word save apparently means something totally different than its common definition. In fact, my plan to save Medicare is radically different from his. I plan on preserving it by expanding its availability to every American.
The average American household spends nearly 50 times more on health care today than it spent in 1960.
Here's where Mr. Ryan begins to play with numbers and distort facts to make his argument look better. Assuming his numbers are correct, $520 in 1960, adjusted for inflation, is equal to $4,025 today. This equates to approximately 6.25 times more rather than the 50 times that he claims. This also does not account for advances in health care, which have drastically improved since 1960, as evidenced by a 9-year increase in life expectancy at birth.
Healthcare spending has gone from consuming just 5% of our economy to nearly 1/5 of our entire economy today.
This is easily explained by the fact that our population is growing older due to modern diagnostic capabilities that allow for earlier diagnosis and thus better management of diseases that resulted in the earlier death of our citizens in 1960. In 1960, of those who survived birth, 64% of males and 78.5% of females at age 65 were still alive. In 2008, 81% of males and 88.3% of females at age 65 were still alive, an increase of 17% in males and 10% in females.
Medicare is a top driver of these unsustainable costs. If we do nothing, Medicare spending will nearly double over the next decade, exhausting its remaining funds.
According to the Congressional Budget Office's 2012 Long-Term Budget Outlook, federal spending on Medicare is equal to only 3.7% of GDP. What Mr. Ryan also fails to mention is that Medicare's Hospital Insurance Trust Fund pays only for Part A of Medicare, which in 2012 accounted for less than half of all Medicare spending. Further, the Congressional Budget Office states that changes over time in the delivery of health care and in the health care system might lead to greater or less reliance on the services covered by Part A. The Congressional Budget Office also projects that should the status quo remain, the trust fund would be exhausted sometime in the mid-2020s, declining to identify a specific year due to future health care cost uncertainty, unlike Mr. Ryan here. Even if the trust fund would be depleted, Part A would not disappear, but benefits could be reduced. However, under my plan to open Medicare enrollment to all Americans irrespective of age as an amendment to the Affordable Care Act, people would pay a capped premium based on their ability to pay according to their taxable income. Medicare beneficiaries would enjoy access to comprehensive, quality, affordable health care that would also strengthen the fiscal viability of Medicare by balancing the costs of the program, ensuring the care of all of our citizens.